October 31 and November 1, hundreds of villagers of Monkey Mountain benefited from services offered by a team of medical specialists who traveled to the village. This is in keeping with a commitment by the Public Health Ministry to ensure all persons in Guyana, regardless of their location, have adequate access to health services. Welcome to InfoHub Extended. Today we take a look back at that outreach.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
I want to say to you that in the interim, however, that next week we're going to send up a medical outreach and they will bring your stuff also. We're going to talk afterwards about accommodation. We're going to send up a team of doctors here so that you can let persons know so that they can come out. We're going to send them in on Thursday. They'll be here Thursday and Friday. All right? And next month, we're going to do the same thing. We're going to send in 2 doctors again to stay with you. And by the time this and next month, we trust that we'll be able to work out something to see how we can proceed from January.
That was Public Health Minister the Honorable Valda Lawrence, who has pledged to do all that is necessary to ensure that Monkey Mountain has access to all the requisite health services. On October 27, the minister attended a community meeting with the residents where she learnt from the residents that for several years the community has not benefited from the services of a medical doctor. 4 days after that meeting, the medical team arrived as promised by the minister. Dental checkups, eye care services, and family planning were just some of the specialized services brought to the residents of Monkey Mountain Village. Over a 2-day period, these residents accessed these and other services.
I feel it's good. The health team is here because it would be more easier to do things like this down in our community instead of going straight to Georgetown. Because out there it's much, some of us can't go there and we don't know the place. So when you come here now, it makes it easier for us to do whatever we have to do.
I see a team of doctors here, and which is very, kind of surprised. But it's good that they're here because we have a lot of sickness that are unmonitored. Maybe the health workers might be able to say something, but then you don't really confirm what it is that we have. But I feel good that they can actually see what is what are the sicknesses, ailments in the area, which needs to be addressed.
I appreciate the visit of the doctors in Monkey Mountain because this rarely happens out here. And right now I'm here to do a small surgery in my feet, and I'm thankful for that because I was wanting to know if I have to pay a passage to go to Georgetown and look that after, which is very expensive. And
Monkey Mountain is a remote village, and oftentimes persons have to travel to Madia or Georgetown to see a doctor for illnesses that the community health workers may not be able to properly diagnose.
I went to the doctor because I concerned of my my health, and I was just paining in my back, and I can't say what because it's 3 weeks now I feel in this pain, and I decided to come to check the doctor and see if I could get help, and in medical situation. And it good if the doctors could come to check the people, we don't know what kind of sickness we have, and we could we happy for the doctors to be here, like if it could be every month.
And I'm very glad about what is happening here now. After so long, we haven't seen no doctors or no medical people here, just the health worker, the two health workers trying their best. But now we have the doctors, and I'm very so happy to have the doctors and coming with all the medications that they have that we need here in Monkey Mountain. I'm so happy that they are here, and I thank them so much. I really thank the Ministry of Health that she did what she had promised to us here.
The senior community health worker, Edialdo One, explained the community's healthcare needs.
I was this periods of time because of some constraints in this community. Then, after going into recommendations and requests, and I'm happy for these past years that I'm seeing a little more development, a little bit more of support. I want to say I was more happy because of the team that is here looking into my load work.
The services accessed by the residents during this outreach were gynecology, dental, and eye care services, among others. Optometry intern Carla Castellano, who saw more than 150 residents, spoke about the service she offered.
Some of the most prevalent cases were pterygium, also known as the growing flesh, and cataract. Basically, what we're doing today is screening for eye diseases like cataract, glaucoma, pterygium, and refractive errors. What we have with us is reading glasses, which we give out to the patients once they qualify for one.
She explained further.
With regards to the pterygium, we usually advise them to wear shades or to protect their eyes from the sun, because over time, the more they're exposed, the faster it grows. For the cataract cases, what we would normally do is make a list and then take it out to the hospital and speak with the consultant there, and they would give dates as to when these patients can come out and do surgery.
Residents of Monkey Mountain also welcomed a proposed upgrade to their health facility and also made recommendations for the betterment of the services currently being offered.
Minister Lawrence highlighted the need for an upgrade to the health center to service Monkey Mountain, taking into consideration the village's large population and the fact that persons from nearby satellite communities access health services there.
You talk about the labs, equipment for the lab, the room, and so on. As I said, that is what we're already embarking. We already have this for an upgrade. So in terms of you having the room and the equipment and so for the labs, that is what you'll be having in the next year. That is in the next year budget for the upgrade of the center.
The health post is currently undergoing expansion and will be further upgraded to provide a wider range of health services.
With the upgrade, residents will have access to a station, doctor, and more emergency services. Here are their reactions.
I think it's good, because remember this is the village, which most of the people are actually passing through to other villages, locations. This is more or less the entrance point from Region 9, where there are a lot of ailments that might be able to maybe passing through. And this might be the first place where you can monitor the sicknesses or whatever.
We need a doctor in our community. Even if he doesn't come to live a lifetime out here, or if we could get a doctor visit every month, would be very fine with us out here. And probably we need more visits from the medical team in terms of a laboratory. We need a laboratory technician, and we need a lab in Monkey Mountain so we can do small tests and these sorts. Oh, that would be fine if we get a laboratory, because we deal with a lot of passerbys in Monkey Mountain, and we have small communities like coming from Region 9 and those in Region 8 that are very close. At Monkey Mountain, we have patients every day. And that would be a very big help. It would mean improving the health standard in Region 8.
Olga also reflected on the improvements.
It has improved a lot because when I was 18 years, we had a population like 300. But it has a vast difference now because we are almost 1,000 people. And during that time, it was voluntary service. I was never given anything by the government. So right now, they're getting a salary. So that's a big improvement.
Monkey Mountain is home to 900 persons, mostly of the Makushi tribe. The availability of specialized healthcare services in the village, which connects regions 8 and 9, is critical to improving the health status of persons there.
Why this much focus on Monkey Mountain? Apart from its large population, this community is an upcoming tourist attraction. Most recently, there has been the discovery and exploitation of semi-precious gemstones. This is expected to catapult traffic in and out of the region. It is therefore critical that health services available in the community are of the requisite standard. This is in keeping with President David Granger's vision for the health sector. The ministry also handed over medical equipment for senior citizens and an ATV, which will aid in the execution of the community health workers' duties. With all this, the senior community health worker in the village observed that this is just the beginning of greater things to come. He is thankful in anticipation and expressed his gratitude.
And I'm much more happier to see things not only in the health sector but in the entire community being developed and being partake, not only with the administration of Region 8 but the entire country, the central government. And we hope things would be better in the future with the central government collaboration, cooperation, and nothing else to say but thank you.
This outreach is just one of many conducted throughout the country to ensure that citizens have access to the necessary health services. This has been InfoHub Extended. Thanks for watching. Goodbye for now.